Jamie Diaz with Barks to Basics. I am here with Dr. Lisa Radosta.
Hello.
My friend that is a veterinarian behaviorist in the area. And if you follow us, you will hear all about that in another segment. So make sure you follow Barks to Basics for sure. But thank you for joining, Lisa.
Thank you.
So I've known Lisa for many years. She just aged us. She said like 20 years, but I think it's like close to that, which is crazy. Yeah. And then when you were saying you got your certificate in 2006, you finished? Yeah, that's right about when I started my, that's like insane. So today we're talking about expectations, well, a couple of things, but we're starting off with expectations of clients. Now, I always tell my dog training clients that there's training and there's management and that there is an answer to every problem, although you may not, an answer might be euthanasia. An answer might be, keeping the dog separated for their entire life. So I always say that, but I love, and I want to know your thoughts on that. And I'm sure you've dealt with every type of pushback too between management and, you might have a great plan and they're like, well, I'm not keeping my dogs separate. I want them together. So I do want you to kind of go over the story of, you did have, can I say aggressive? Was it an aggressive Rottweiler?
Oh, yeah.
Aggressive Rottweiler, and you had your daughter.
Yeah.
Can you tell us like a little bit about that? Were you in medicine then? Like what was happening on that story?
So when I got pregnant in 2007 with my daughter, I had two Rottweilers. One was Perfect, my heart dog, Sweetie, and the other one was Peanut, who I took as a rescue, third home at 7 months. We knew she was aggressive. And she got along with Sweetie at the time when I took her. So by the time I had Isabella, Peanut and Sweetie were completely separated. We had done everything, and this is my job. I'm telling you, I did everything, and I was so tired of seeing Sweetie go back into the ER because Peanut would just beat the living daylights out of her. And Sweetie outweighed her by 1.5 dogs. But Peanut was one scrappy little dog. And so they were completely separated. So then when I got pregnant, of course the calls come in. Are you going to euthanize Peanut? So I'm not going to judge anyone who makes that choice because I have a very high tolerance for aggression in my own home, right? Because that's what I do. I'd be sort of a hypocrite if I didn't have a high tolerance for that. So I decided to keep Peanut. Peanut never met my daughter. 0% of the time did she ever meet my daughter. So, but the difference, so when I say I don't judge people, so by the time I got there to that point, I'd had Peanut a long time. Peanut knew how to stay by herself. This is a huge problem that people don't teach their dogs to stay by themselves. It's just a nightmare problem. She knew to stay behind a baby gate. She was very happy to stay behind a baby gate. She knew how to occupy herself with food toys. She understood every cue I could have taught her. Before you have children, your dogs are well trained, right? This dog knew everything. So she was prepared for this life where her circle would get even smaller than it already was. But I recognize some people, their dog is their baby. They have a baby. They didn't prepare their dog just for life in general, much less for a child. And it's really, really stressful for the dog. So Peanut and Isabella and Sweetie stayed separate. Sweetie got to be with Isabella.
I was gonna say,
yeah, she was with Isabella all the time. But Peanut stayed separate from everybody else, dog, cat, and my daughter for the rest of her lifetime.
Wow.
Yeah. And, I tell people I did it. Honestly, it just becomes your new normal. When you have a child, your life is pretty inconvenient, but that becomes normal for you. Mm-hmm. It just became normal that we had to purchase a house with enough space that we could cross fence. Dog in the back, dog in the front. If we couldn't have afforded to cross fence, we knew we weren't going to build a house. So that is just our sort of way of living, right? That we accommodated Peanut's needs, and it was our normal. Lots of people will not, don't want, can't do that, and that's okay too, right? The other thing too is that Peanut had nowhere to go. Nobody would have wanted this middle-aged Rottweiler who had a bite history with dogs and people. I lost a nanny because of Peanut.
Really?
I told the nanny, I said, because I had a nanny 2 days a week, and I said, okay, once you leave, you're gone. You cannot re-enter my house because then I'm going to let my dog out. You cannot come back in without calling me, knocking on the door. She just forgot something. And she walked in the door and Peanut nailed her in the thigh.
Wow.
Yeah. Like Peanut was serious. She could never be with my child.
Wow.
Yeah. For some people, that would not have worked. And that's okay. Then we have other options. But one option that's not on the table is letting the dog be with your kid.
Yeah.
That's not one of the options. You might have wanted that. And I tell people, now's the time to grieve that. You go home and cry about it, grieve about it, do what you need to do, work with your therapist. I'm not joking. Like, do what you need to do, because it is a moment of extreme disappointment. Your dream, my dream as a mom, was for Sweetie to be able to be with Isabella so Isabella could experience the extraordinary love of a dog, right? So imagine if Sweetie was my only dog and she turned out to be aggressive to my child. I have to grieve that. That's real. So I tell them, go home and grieve. And then we need to keep your dog separate from your child. It won't change the reality we're in right now.
So do you find a lot of pushback from people with certain suggestions? Because I've found there's certain cases, they're usually two female dogs. They got along the whole time. All of a sudden they start fighting. And when I say fighting, it's like sending, I think I worked with you, I think it was 2 Wheatons, but forever ago, you know, my solution, it kept happening. I mean, this dog was getting staples, and I'm like, you have to keep, first of all, you can't adopt it out. I don't think it's ethical for you to be able to, you know, you're going to adopt this dog out and then the neighbor's dog comes over to play, and, you know, so what happens when you suggest something? So my suggestion would be keeping them separate. I mean, do you get a lot of pushback for some of your, and are you ever stuck that there is not another option? Like, if you don't keep these separate, what would be the other option? Like, what kind of pushback, and what do you do in those situations?
Yeah, so I give people choices. It's their choices, and I tell them the consequences. So with inner dog aggression, you got basically 4 choices. If you have a close family member who can take your dog, then consider rehoming. Like, a lot of my clients have kids who are in college where the child can take the dog, right? They have their own apartment. They're at that point in their college. And then the dog just comes home during the summer. We separate it from the other dog. Like, if that's an option for you, great. Option number 2 is to keep the dog separated for life. This is surely what the dogs would vote for. And people come back and they say, no, the dogs are on either side of the baby gates and they're crying to get to each other. And I'm like, maybe, or maybe they're just crying to get to you, right? Maybe they want to be close with you and not with the other dog. And even if they are crying to get to each other, being together is dangerous. So why would we ever promote that? So that's option 2. Sometimes you need meds for that. Sometimes you do, just to help the dogs accept that separation. Option 3, work with a positive reinforcement, qualified dog trainer, right, to help reintroduce the dogs. 2 to 6 months, medicate both dogs.
What does qualified mean?
So qualified for me, these are my requirements. Positive reinforcement, which means that they never use shock, pinch, and choke, okay? Because positive reinforcement, again, not really that has a scientific definition, but when we apply it to people, it doesn't really have a definition, right? So there's that. I like certifications because it means that somebody did something they didn't have to do in order to gain more knowledge. I like that idea. There are certain ones I like more. There's Victoria Stilwell. There's PPG. There's KPA, Jean Donaldson. We have CPDT is another one that people can get, right? So a certification, and also qualified in that problem. So I love that you said separation anxiety is not my jam. Could I do it? Yeah, but it's really not what I love to do, right? So then maybe you would say, but I have this friend, right? That's what a good professional does, is they go, but I have this friend that I can refer you to, right? And so also we want to make sure that they understand dog body language and dog learning, right? Which a lot of human beings don't understand, right? You have to really know that to get 2 dogs back together. You have to understand that a lip lick and turning the head away means the dog's about to freak out. Like, if you can't intervene then, there's just going to be dog fight after dog fight. So option 4 is to get the dogs back together,
which
full
you've
on.
Done.
Yes, but there is a 50% relapse rate.
Oh.
Based on the statistics we have on dogs.
Wow.
So even people that go all the way to the end, up to 59% of those dogs are to the point where people can leave them unsupervised. There's about a 50% relapse rate. That is a huge relapse rate. Like, if a doctor told me we are going to do this surgery that's going to cost you thousands and thousands of dollars. There's a 50% chance you're going to get the disease again. I don't know if I would do that. So what we're asking of these dogs is big. And this is how I tell people. I say, look, there's a person in my husband's family who at the very beginning of our relationship rubbed me the wrong way. I have been married for 26 years this year, and I dated him for 7.5 years.
Wow.
I still can't be with that person. I still love my husband, but I still have not adjusted to that person. Now ask me to live with that person in my house. That's what you're asking. They're not brothers or sisters.
Right.
That's not what they are. You put two people together that didn't know each other. They don't want to live together, and you're forcing them. I would have to be drunk, drugged every day to live like that.
That's such a good analogy.
Again, no agency. So I would strongly encourage people to consider all the options, decide what they want, and to, if they can, this is so hard as a human being, to make it less about you. I want my dogs to be together. I want to sleep with both dogs. I hear you. But what do the dogs want, and what do they need? And when people say, no, they're going to be back together, I'm like, okay, we're going to charge forward. Get ready. It's going to be a year. Just have it in your head. And
At
then,
least, right? Yeah.
Right. Yeah.
I actually did that. I didn't think things through before I had kids. 5 dogs at the time.
Oh my God.
When I had my daughter Grayson, I had 5 dogs, and Oreo, rest in peace, he died last year. My one dog, Bocce, that I found on the streets, of course, because that's what we do. We rescue dog from the streets and let's keep them in our own homes. So he was a resource guarder, and with bully sticks, it was fine because he would just take them all and the dogs learned not to mess with them. So there was never a fight for that, but space. So when Oreo would jump off they used to sleep with me. When Oreo would jump off my bed and he'd try and come back up, there was a fight. So I remember I was pregnant. It's 3 a.m, and Oreo used to jump back, get water, like come back. He was an old man, and a fight like on my belly. I was like, no. So I started one option, right? Crating him every night. So he would watch us. He was fine. He crated, which a lot of people won't want to do that when you said the sleeping. He was fine, crating. After a month, put him back, fine for 6 months. Then they would start fighting again. Yeah. So my mom wanted to get a dog, and I was like, why don't you try Bocce? And it was the best decision that, first of all, when she goes to New Jersey, he just wouldn't sleep in the bed with us, but we would take him. So when she would visit, he was used to our house. He was great with the kids and everything. But they had this trained dog that was an amazing by himself dog. They still have him. He's 15 now, 16. They still have him. He's amazing. They bring him every time they come over. No issues. So those were the options, right? You can not sleep with your dogs, or if it's that bad, you can. And with now I have 2 kids, but with the baby coming, everything going on, I was like, no, there has to be an option. So I think, like you said, expectations for clients. And also, I also know there's not a one fit. There all of the options, right? Because sometimes I give people a training plan, and I'm like, you're not going to do this, are you? They're like, no. They're either late. I'm like, then we're not going to do it. Like, I can teach your dog go to your place. He'll stay when you open the door. He'll do this stuff. You just have to practice once a day. Are you going to do that? No. Then it's out. Then we're going to go to management and put a gate there so that he can't run. So it's really about expectations of telling the clients and the reality of, listen, if you have an aggressive dog, you really have to think about these things, because like you said, one option is if you don't do it, your child will probably get bitten.
That was a non-negotiable for me, and people say things like, well, he's fine 80% of the time. And I said, no problem. You have a gun. It's loaded. You should right to have a gun. And you leave it on the kitchen table, on the coffee table where your toddler can reach it. You think your toddler's probably going to approach the coffee table only 20% of the time. What are you afraid of? Put that gun up there. Let's go. Leave it ready to go. And they're like, what? Are you kind of crazy, woman? Like, yeah, but that's what you're doing. Sure. You have a dog who bites 20% of the time. So how much risk are you willing to take? My daughter is everything. I'm willing to take zero risk. Mm-hmm. And I also understand, by the way, that when Peanut bit, it wasn't like her hobby. She wasn't having a good time. She was out of control internally. Mm-hmm. So why would I wish that on someone that I loved, even if that someone is a dog. And I think a lot of, behavior problems have a lot of feels. So if your dog has diabetes, okay, so your dog has diabetes, you do the things, you treat the diabetes. But when your dog has aggression, it feels like a personal affront to you. I saw a client the other day, and I ask for videos because I don't want them to try to get the dog to do the thing, but we have our phones all the time, so they usually have videos. And so the video is of this very cute little dog, and she uses her voice a lot. And she uses her voice on walks. And so I was trying to determine, is this dog nervous? Is this dog excited? Is this dog conflicted? Like, why? So I looked at it, and yes, the behavior was annoying, and the dog is a little conflicted. But the dogs who are conflicted in a happy way. So they want to approach, but they're frustrated by the leash. They're not intending to hurt anyone. They're trying to go toward, right, in a friendly way. So I asked her straight up, explain to me why this is a problem. Like, why?
Right.
What's wrong with this in your mind? It may sound like a very stupid question, but I have to understand. And she said, well, the whole neighborhood can see me. And I'm like, okay, so this is a problem because it's embarrassing. Mm-hmm. And she's like, yes. I said, okay, now I understand. So she has to be completely quiet for you not to be embarrassed. She's like, yes. So now that I understand, now that I was honest and she was honest, I can say, this is what it takes to do that. So then I can say, well, that's going to take a medication given in an hour and a half before walks. You're going to need to work with a positive reinforcement qualified trainer. And I don't know what that costs. I deliberately, do not ask because I don't want to be misquoting. I don't know what that costs, but you're going to be doing it once a week for 3 months. Well, then the story changed. Suddenly, it wasn't worth it anymore.
I don't mind.
I don't mind a little barking, right?
Yeah.
So, and then I might offer something like, why don't you just toss some treats in the grass and tell your friend to come over? Like, can we just make it less gold standard and more reality? So I think you can have what you want most of the time if you're willing to do the thing.
Yeah. And it's about knowing those expectations and like you said, changing it. Oh, I'm not doing that once a week. Now I have to dive into this with you because you are a veterinary behaviorist and you have all of the background behind you. And so, we're saying force-free trainer and we were talking before, everything isn't, I use punishment, right? I'm not using physical punishment, but if you are whatever with the toy, like the toy goes away or you lose me, I'm leaving. So one of the myths that I wanted to debunk is punishment-based training. Well, this is a trick kind of thing. Punishment-based training is effective. And we were saying it is effective, which I tell people. That's why there's still shock. And for the record, we're talking about shock collars, prong collars, and chokers. I don't use any. I've never have used any, but they are effective, right? If
they can be
used
right. So that's
correctly.
the thing. So we're going to just depart from all the feelings we have. We're going to recognize. I'm going to recognize right now that you and I are committed to not using those tools, not using physical punishment. There's a reason why I don't have a dog in my house now, but the reason why when I have a dog, they're naked. They don't wear a collar because I don't want to be tempted to reach for the collar. Like I am die hard. And also, I'm a scientist, right? So we recognize that in the 4 quadrants, 2 of those quadrants involve punishment. Punishment can be effective when applied in the right way. So why don't we use it more? Well, we do, right? When I walk into a house and a dog jumps on me and I walk out of the house, I'm applying punishment, right? So I'm removing something the dog likes in order to decrease the behavior, negative punishment. So if we're talking science, we use punishment all the time. We hold the food bowl until the dog sits. Well, that would be positive reinforcement. Or if we picked it up, right, could be negative punishment. So what we're talking about is the application of something that hurts.
Yeah.
Okay. And so could those be used properly? In theory, they could. However, again, I'm always going to go back to what I can prove with science. What we know is that even skilled shock collar trainers, when their work, so dogs taught a certain behavior, okay, by shock collar trainers who are skilled, that is put up against a group of positive reinforcement trainers who are skilled teaching the same behavior. Are those dogs both taught the same behavior? They both learn. So why wouldn't we just use the shock collar? Here's why. Because the dogs taught by the experienced shock collar trainer we're physiologically more stressed. So we have two things that work equally well in extremely skilled hands, and we are going to deliberately choose the one that causes dogs physiologic stress instead of making them happy and wanting to work with you. Now, let's separate from highly skilled, because look, my surgeon who repaired my tendons, right? He's highly skilled. Now, my husband is a surgical device rep and he goes in the OR. Why didn't I just drink a bunch of vodka and have him repair my tendons, for God's sake? It would have saved me a bunch of money. Why? Because Dr. Cohen is like the bomb guy. He really knows what he's doing. So the fact that there is a technique that works, it only works in the hands of those who are really, really skilled. So what can happen when someone who's unskilled throws a bunch of treats at a dog who's jumping?
AKA a pet owner.
Right.
Most pet owners.
Right. So let's just say we do that. What could happen? Well, he could gain weight. We'll just look at all the options. He could gain weight. He could learn that people throw treats, and then the next time he sees a person, or maybe 20 times down the road, if they keep doing it, he will look at the floor instead of the person. He could jump more. Those are all different outcomes, and I don't love the fact that he could jump more, but I'm not going to hurt him and he's not going to be traumatized. What happens when you put the shock collar in the hands of someone inexperienced? This particular concept has reams of research to show that the random shocks are what really traumatizes dogs. Heart rate, respiratory rate, body temperature, cortisol shoot up. And what do pet parents do? They get frustrated and randomly shock. Dog has shock collar on. In the backyard, they say, dog come. Dog doesn't come. Dog come. Dog come. Finally, well, the dog is busy with the squirrel. He's not listening to you. And he gets the shock out of nowhere. He doesn't know where it came from. It's really scary and traumatizing. Now I have dogs who won't go in the backyard. And by the way, when you put a shock collar on your dog, you make it really hard for me to fix the problem.
Yes.
Like, you're making it so hard for me to fix the problem.
Why do you think, like, so when I post about, you've probably seen on shock collars and stuff like that. When I post about it, I thought everybody was for like the force free, and it is crazy how many people are just like, just use a shock, just use a prong. And, you know, I used to get so upset. Now, obviously, with my clients, I'm able to, but I didn't know how many, I don't know if people are looking for the quick fix and they just see that. And I don't think they understand the fallout for your dog, how like psychologically damaging it can be for them, physiological, like you just said, to use these things. As a doctor, like you just said, would you ever suggest any of these to any of your clients for any reason?
No, never. I never would. And here's the thing that people also don't understand. Again, like, so when I plug my espresso machine in, that espresso machine has had to go through, the manufacturer of that espresso machine has had to show that it's not going to kill me. It's not going to electrocute me. There's some safety, right? We don't have that same oversight over these devices we're putting on our dogs. And electricity, the reason it's, in wires, and I'm not an electrical engineer, but the reason we treat it special is because there are special properties that allow electricity to be conducted. Well, if the collar is today too close to your dog's skin, then he gets a different level than he did yesterday. If he has long fur and the fur is wet, there will be a different conductance of that. If the fur is dirty, if it's humid outside, which, oh my God, it always is here. So what I'm trying to explain is we talked about punishment, the science of it and when it can work. One of those foundational pillars of making punishment work without traumatizing the patient or the pet, right, is that we apply it the same way. But you never know what the conductance will be off that shock collar onto your dog's skin or your dog's fur. That's why in the ER we see burns, right?
I've never heard it explained like that. It's like, I knew that, but it's eye-opening to hear, like, all of those things make a difference.
Yeah, like you can't control. So today you always have your little thing set to 5, but tomorrow your dog gets a 4, and today he gets a 5, and the next day he gets an 8, because the conductance of that across the fur is going to be different. Like, you're screwing your dog's brain up so bad. Like, I know you want the quick fix, and there's a lot of quick fixes. They just feel more inconvenient. Like, if I don't want my dog to charge the front door, I can put my dog in a room. Or I could shock my dog.
Right.
But putting your dog in the room is fixed. We're done.
Yeah.
It's fixed. But you don't want to do that. Why don't you want to do that? There's we have to address the whys of why people don't want to do that. Because even with all that I know, I still can have empathy for people who choose that, because I think a lot of times they're feeling a little bit desperate. I think they're feeling like there isn't another option, and so they're doing something desperate. Maybe their neighbor has said, I hear your dog barking when you're gone, and I am going to report you to the HOA. And they're like, holy wow. Like, I'm going to research trainers. I'm going to go to my vet, but tomorrow I'm going to be reported to the HOA. I'm going to go buy this thing at PetSmart or wherever they buy it, right? So I think that I also want to recognize, if you're out there and you're saying, oh my God, I'm an awful person for using a shock collar. Look, let that go, because shame is 100% of the time never going to help you in this situation. Take your shock collar, throw it in the outside garbage, so you're not you're not at all tempted to dive into the garbage and get it, and do the work that's necessary. And it might be something very, very simple. It doesn't have to be hard.
Yeah.
It doesn't.
I think it's so important to hear from a doctor say these things, because I say them and people say, I don't know what I'm talking about. And by the way, for owners, when they come to me with a shock collar on, they're just doing it to help. They think they're helping their dog. So I used to get really mad and upset with them. And now I'm like, they're not doing this to, like we said, I can smack the crap out of my dogs and they will listen.
Right.
Not my dogs, my kids.
Right. Either
my
one.
dogs too. My
Either
kids
one.
or my
Right.
dogs. But I think it's so important. And I had to bring up this topic because I can literally talk for 2 hours about this, but sometimes I don't have validity in what I'm saying, because I maybe don't have the credentials like you do for the people. And there's like really scary people out there on social media telling people to do these things. You would die if you saw some of these things. So I just had to bring this up for, to let everybody hear that this is not what you should be doing for your dog. There's a better way and an easier way a lot of the
There's
time.
a better way, an easier way. It doesn't have to take forever to use positive reinforcement training. It just means that you're going to do things that might, that you might have to learn a new skill. And people put a shock collar on the dog and they don't think they have to learn a new skill. They can just push the button and terrorize the dog. But like you say, you could also smack your kids around, but you choose not to do that, right? There's a difference between obedience and respect. The people I respect are people who I trust, who I know wouldn't hurt me deliberately, who wouldn't lead me astray, right? I want respect from my dog. I want my dog or my cat or my horse, when my horse is alive, to come to me because they knew I was safety. You better get over here, because I'm going to build a wall around here and ain't nobody going to hurt you in this space.
Yeah.
Nobody's getting in. And there's many times where I have thrown down in front of a dog trying to attack my dog, because I used to live in a rural area. Like, my dogs knew I was safety. So how in this circle of safety could I hurt? Like, it doesn't even make sense.
Yeah.
I want a dog who listens to me, yes, because they want to listen to me, not because I'm willing to hurt them to get them to listen to me. And my kid is like a Rottweiler. You can't push my kid. So I had to have that same way with my 17-year-old. If you push her, she resists. You have to earn their respect, which I think is something we really are missing right now.
We're missing it. And I have to say, well, one, thank you again I know how busy you are, for joining us. And I think it's such an important topic, and hopefully you'll come back, because I feel like I have so many things that I did not get to, but you see clients around the world, you do talks around the world, she has books, everything, but she is a veterinary behaviorist that you can see virtually if you're not in the country too. And where can people find you? What is the easiest way? And also I wanted you to talk about your book too. The
easiest way is to go to my website, drlisaradosta.com. You can go on YouTube, LinkedIn, Instagram, or Facebook and go to Dr. Lisa Radosta. You'll find me. My book for pet parents is From Fearful to Fear-Free. And then my textbook, if there are veterinarians out there, or a lot of pet parents like to have behavior textbooks. So that's called Behavior Problems of the Dog and Cat.
I've seen that one, and I'm not smart enough for that
That's
one.
not
but
true.
The first one, I really like. No, it's really good. But I will say too, I hope people follow your social media, because I learned so much. I have like a WhatsApp for my staff, and I'm constantly reposting them on there. And it's just things you're so skilled and experienced and have the educational background behind it that you just say things sometimes in a way that you don't think about it. Even myself, I'm like, I didn't actually, think of it that way. So follow her Instagram too, which is Dr. Lisa Radosta on there as well, right?
Yep.
On all of the things. You can follow us and listen to this podcast anywhere, Barks to Basics, where you can listen to podcasts, which are Audible, Spotify, even iHeartRadio has their own, which they reminded me about. That's very easy to get to, and they're free. And also on our social media, at Dynamite Dog Training, at Lucky Dog Training Club, and follow us everywhere. Thank you again so much for coming and talking to me, and hopefully we'll see you again soon.
Yep.
Bye, guys.